Hey guys, it's Alex, and today is August 25th, and I will be 4 weeks, 1 week on T, or 4 months, 1 week on T, sorry about that, and this week I'm going to be showing you guys how to do a subcutaneous testosterone injection. So, first of all, what makes a subcutaneous injection a little different is that you won't be injecting into your muscle or directly into your bloodstream at all. You're injecting into one of the layers, the deeper layers of your skin. So what it's supposed to do, and what my doctor said it would do, was that it'll help to make the T in your body more consistent rather than doing it directly. So the T would be your dose would be higher the first day that you inject it or the day after, and then as the week goes on it would start to settle off. So this way it's supposed to be more consistent, so it's about the same amount in your body. I don't really know if it does that or not, but that's the science behind it. So I'm going to show you guys how to do that. And to do that, you won't be seeing my face, so here you go, your lovely display for the day. So you're going to need several things. The first thing you're going to need is your T, which is going to be prescribed to you in something along these lines. And it's got like a child safety lock on it. So you just pop it out, and it's going to look like this in this little bottle. It's a liquid. I don't know if you guys can see it. It's a pretty thick liquid, so you have to remember that when you're injecting, how thick it is. And then it's a really good idea that when you're storing this to have a box, and it just kind of keeps everything in place, and that way if someone were to go through your house or to go through your things, they wouldn't really see that or whatever. So I keep mine in a box like this, and it holds all the needles and everything that I need in it. And so what you're going to do is you will need the T itself. You will need the syringe, of course, which I got a new kind of syringes, which these have 1 full milliliter on it. So your dose will be between, depending on your blood and depending on when you start T, will be between, I believe it's 4.4 and 0.8 probably is normally what they put you at, because a normal male, a cis male amount that they have in their blood in their body is 1 full milliliter, and that is a lot of this. So you need this put there, and then you need 2 different kinds of needles. One needle is a pinkish one, at least that's the company made it, and it's an 18 gauge 1 needle, and that is what you use to draw up the T. It's a bigger needle itself, so that's what you'll use to do that. And this one is a blue needle, at least that's how the company does it, and it is a, I guess, a 25 gauge 5/8. That one's a lot smaller. That's the one that you inject with. It'll hurt a lot less, trust me. You also need 2 alcohol swabs, a gauze, a band-aid, and lastly, a container to put all your needles in. Preferably a plastic bottle. Normally they say put it in either a milk carton or laundry detergent, but all I had at the time was this Mountain Dew bottle, which does the exact same thing. So the first thing you want to do is wash your hands, and I did that off camera, so you can't really, the next thing that you're going to want to do is you're going to want to get everything out that you need, and put everything away that you don't need. And you're going to want to put it on, I put it normally on a paper towel, and this kind of keeps everything sanitary, because you want everything as sanitary as possible to avoid from infections in your injection site. So what you're going to want to do first is you're going to want to unpackage everything. But when you're unpackaging these things, they come in like a sealed thing like this. And you don't want to touch the tip of it. Don't touch the tip, because that's what's going to be like where you switch needles. So that's basically what could get bacteria on it, and that could infect you. So you're going to want to, you can hold this part of it at the very end, but just peel it up, and then just leave it in there because you don't need it quite yet. And you can do the same with the needles. Just kind of peel it back, but leave the needle in there. And for the needle, you don't want to touch that end where it will be going into the base of the syringe, but you can touch the tip and all that stuff as much as you want. Also, over these, they have a clear plastic casing over it, so that way you're obviously not stabbing yourself when you aren't using them. I always kind of open my gauze too, because as soon as you do your injection, you are going to need this. This gauze is way more gauze than you will probably need, to be honest. You probably only need like a square about like that size, but this is like huge because it came from this weird package. And then you're going to want to take an alcohol wipey, rip it right off, and you are going to wipe off the top of the bottle that holds the testosterone. This is also to keep everything sterile and to make sure it is all clean. Don't want any bacteria or anything on it. And you can put that aside. So next, what you want to do is you want to take your syringe, and you want to take your larger needle out, and it screws right on, right like that. So now what you want to do is you want to make sure, first of all, that it's not too tight, so you can unscrew it, because we're not going to leave this needle on to inject you. But you're also going to want to pull this off. I kind of have a fear of pulling this off because one time I pricked myself. So what I normally do now is I take a basic, it's kind of like a mouse pad type thing, and I just use it to grip the the plastic part that covers it, and I just pull it straight off and then drop that down because you'll need that afterwards. And here you are, got your needle. Now this is a very large needle, which you definitely will not be injecting yourself with. If you do, you will definitely know and be sorry, because it's going to be a lot bigger and thicker. And what you're going to want to do is right in the center, it's kind of like a corky type material or rubber, and you just stab it right through. And then you lift your bottle and I'll put it upside down, and you're going to want to put the needle under the liquid. You probably won't be able to tell on this one, but you want the needle submerged, and you're going to want to take your 2 fingers as you're doing this and slowly draw it out, trying to get as few air bubbles as possible, which can take a while because it is a thicker liquid, so do keep this in mind. If you're being impatient with it, it can take more air bubbles, and that's not something we want, because that can be harmful for your system. You can see the air bubble, you just kind of force it out. So once you're all set with that, you just pull it straight out, put your tea to the side, take this cover right over here, and you just insert it right there. There you go, all set. And we won't be needing this part right over here anymore, so you can just unscrew it and put it back in its little covering over here. And then you can take this and screw on the blue needle, the smaller one. Just screw that bad boy right on there, Okay. And this I'm also going to put back in here, just to also avoid cross-contamination, or whatever it's called. Okay, and now you are ready to get your injection done. So what you're going to want to do is you're going to want to be sitting. I do thigh injections, and I do rotations every week as to which thigh I do. This week I will be doing my left leg, so I may have to on my computer a bit to see it. I'm going to strip down now, so don't be alarmed at the fact that I will be slightly more naked than I was before. So now what you're going to want to do is you're going to want to feel around your leg, which I'll move this so you can see a bit better. You're going to want to feel around your leg. It's going to be around the outside of your thigh. You don't want to go into your inner thigh at all area. And you just kind of feel around. Feel, hey, what's good here? What's a good area that I haven't maybe injected? So I'm going to go with, like, right here. I haven't gone this far up in a while, so I'm going to go over here. So what you're going to want to do is once you have an area planned out, you get another alcohol swab. And I want to wipe that area all down so it's all sterile, ready for you to inject. I normally do a little bit of surplus because I don't always get the exact same area that I was feeling earlier, so it's always good to just get a good consistent rub-in. You're going to want to take the needle and you're going to want to hold it at a 45-degree angle, pointing at your skin. And with this hand, you're going to want to push in with your right hand, and with your left hand, if this is how you're dominant, you're going to want to squeeze that skin gently. And really, the biggest thing here is to just do it right away. So you're just going to do 1, 2, alright, hang on. 1, 2, 3. Push it right in there. Which really shouldn't hurt. You're going to want to hold the tip with one hand and push in the T with the other hand. Your left hand that is holding the tip of the T should be absorbing the pressure that you're putting on it, because it does take a lot of pressure to inject it, and it may look like I'm not even really moving much further, but it is injecting it. It is a very thick liquid. Alright, so once you're at the end, you want to push it a little bit more. Make sure it's all in there. Now you don't want to pull it out immediately. What you're going to want to do is you're going to take that gauze. As soon as you pull it out, you want to cover it. And you take your needle, put it to the side. Sometimes it can hurt a little more than normal, than other times. And other times you really won't feel it. And what you're going to want to do is with the gauze, you're going to want to rub it in gently, just to make sure that it all gets spread out in there. Give it a little minute, because sometimes it can bleed a little bit, sometimes it can bleed a little more than other times. It really depends. Today I bled not too much. So now you want to take a Band-Aid, as so, and mine aren't as cool, sadly. I still need to get cool Band-Aids. You just cover it right up. So I hope I helped some people out with this and showed you guys a little bit on how to do a T injection. I'm sorry if this video is kind of long, but I'll see you guys next week. Bye.